We've got to do better at education. People don't understand, but you will understand when those hospitals in rural America start closing down even more.
And it has already begun, as was previewed there by Jasmine Crockett, as many people said in response to Donald Trump's big budget bill or whatever. There is going to be a price to pay, and rural healthcare is going to pay a big part of that cost. We're already seeing it happen now. Augusta Medical Group, they've announced that they're closing 3 of their rural clinics in Virginia. The company said in a statement earlier this month that the closures were part of Augusta Health's ongoing response to the One Big Beautiful Bill Act and the resulting realities for healthcare delivery. These are the realities, I guess. And isn't it ironic that Donald Trump, who has so much support from the MAGA movement for like sticking it to the libs and everything, it's not the big city ones that are getting closed down. It is rural access to healthcare. And sure, that's going to affect a lot of Democrats. There's Democrats everywhere, but it's also going to affect a lot of conservatives, a lot of Trump voters. And we tried to warn you that this is how they're going to screw you over. And now we're already seeing it. And by the way, candidates should, they will, and they are now using these closures in their campaign ads. Candidates for governor there have been among the most vocal about the threats to rural healthcare. And so you're seeing that across a number of them. You have Interior Secretary Deb Haaland in New Mexico talking about it. You have them in states across America because these sorts of cuts are going to happen distributed across America as time goes on. And we know, like from the polling that was done when the bill was still being debated, how wildly unpopular much of it was. When people know some of the specific aspects of it, including the threat that it poses to these healthcare facilities, the possibility of them being closed down, it becomes even less popular. So if you take a look at this poll from KFF, in terms of favorability towards this bill, it was at 35%. When you point out that it would decrease funding for local hospitals, it drops to 21%. There are few things you could come up with that are more wildly unpopular than what the Republicans chose to do. And now they're gonna have to live with it politically, and all of us are gonna have to live with it or try to live with it because of course, this is very much a matter of life and death. And I just wanna remind everyone, so they did one thing to try to be like, hey, everybody, don't worry, it's totally cool that we're gonna be shutting down all these things. We're gonna do this hospital defense fund. We're gonna put together $50 billion for rural health, which by the way, even there, you had to have a lot of Democrats fighting to make sure that that actually got passed. That is a short-term patch. That is not even really a patch on how much is going to be cut. And it's a one-time thing, whereas the cuts are ongoing. And so they're hoping, I guess, that maybe that helps a little bit in terms of the strike back during the midterms. But going forward, things are only gonna get worse year after year. And again, it's gonna be in a lot of the red areas where they feel it the most. Sharon, what do you make of this?
Yeah, and wasn't it Bernie Sanders who said, you guys are playing this little carnival game because you took out this much, you're sprinkling back this much, we're still at a loss. And this is real because even before this nasty bill that they tried to tell us was beautiful, there was consolidation and greed and people in these rural areas, which by the way, so many of us live in these cities and we forget that there's a whole big life out there in these rural areas. They will die. Towards the end of my mother's life, do you know how many times I had to depend on a hospital? If it's an hour or more away, forget it. But that's the point. They actually believe that you should be put out to pasture. It's a simple equation, and who cares?
Yeah. No, 100%, and they don't. These Congress people, these senators, are they gonna have to drive 2 hours to get to a place? What, like you think Fox News hosts, like where they live in big cities? Again, I love that they constantly talk about like, oh, these damn lib cities, they all live in New York. Every one of them lives in goddamn New York City. Their hospitals aren't being closed down. They get great care, man. They're never gonna have to drive an hour and 45 minutes. But the people watching their show, they're shaking their fist at the Democrats. They're the ones getting screwed over by the people those viewers unfortunately chose to look up to.